Thank you, Dr. Werner. Mr. Speaker, Mr. Vice Speaker, officers and trustees of the Illinois State Medical Society, to our delegates, alternate delegates, and our guests, thank you for your trust and for the honor of electing me to be the president for the Illinois State Medical Society for this coming year. I look forward to the opportunity throughout this year to take our message around the state, both to society member physicians, to non-member physicians who need to join with us, and to the lay public, our patients. I go forward with more than just a little fear and trepidation, since public speaking is certainly not my forte. I've had the opportunity to get to know many of the fine doctors in this assembly, but there are also many I have not had the opportunity to meet yet. I hope to remedy that as I perform my duties as your president this year. I'm a general internist practicing down south in the city of Belleville. This is in St. Clair County, which is a name known to you and infamous for being consistently rated as one of the worst judicial hellholes for our state and for our nation. My first 4 years of practice were with the Air Force at Scott Air Base outside of Belleville, and then the next 28 years have been in Belleville-based civilian life. My practice is mainly geriatric, and I've been so pleased to have the opportunity to care for some of my patients for almost 30 years. I still see patients in my office, in the hospital, and in nursing homes, but that's becoming more and more difficult. I find it challenging to balance difficulty with electronic record systems that are incompatible between hospitals and between hospitals in my office, and state regulations that have become much more onerous for nursing home patient care. But I try to practice in the manner of the physicians who cared for me as I grew up. As I make my way around the state this year, one of my themes as I talk with patients will be the importance of having a primary care physician and getting to know that physician well. Let me explain why. I grew up in a rural agriculture area in southern Illinois. I'm from the Carlisle area. Well, actually, I'm from an even smaller town, 5 miles from Carlisle, called Beckemeyer. Well, I grew up on a farm about a mile away from Beckemeyer. This is the same farm where my father was raised, and it's the farm where he and my mom raised their family of 6 children. And our family doctor was Dr. Wilson Ducombe. Dr. Wilson Ducombe was a general practitioner who graduated from St. Louis University Medical School in 1927. And after graduation, he joined the practice of his father, Dr. James Ducombe. But Dr. Wilson Ducombe was our family doctor, cared for my family, treated many of my neighbors and many of the residents in Clinton County. That's what he did, and that's where he served throughout his professional career. My dad is now 92 years old, but back when he was 16, he was sick with scarlet fever, and he was ill for about 6 weeks. Dr. Ducombe came to our farmhouse each week for about a month to check on him. But this wasn't a typical house call by any stretch. The roads around there are not paved, were not paved at that time. They were very muddy at times, and a few of those times a car couldn't get through. And Dr. Ducombe was brought in by my grandpa on a horse and buggy. Later, after my mom and dad married, Dr. Ducombe delivered all of their children, and he was happy to see that the roads had improved and it was easier for him to get around. He got to know my family well. My oldest brother had a school accident when he was in 4th grade. There was a joker in his classroom who took a sharpened number 2 lead pencil, pushed it through a sheet of paper, and set it on the seat of the desk while the students were out at recess. After recess, the bell rang. Everybody ran in because they had to be in their seats when the class started, or the teacher would be pretty upset. And as you can guess, my brother sat right down on that sharpened pencil. It drilled through his jeans, into his gluteus maximus, and broke off. I wasn't there, but I heard that the screams were pretty loud. My brother had to be taken to Dr. Ducombe's office for some local surgery to get out the foreign body. But you might guess that this was a source of long-standing jokes going forward about my brother, who had trouble getting the lead out of his derriere. But 12 years later, when my brother and his wife were having a child delivered by Dr. Ducombe, he was joking with my brother about the lead pencil accident and how he finally got the lead out and shaped up. I remember another time when Dr. Ducombe, I had to go to see him for a school checkup, and my mother brought me. And after the appointment, Dr. Ducombe turned to my mom and started talking to her about things like her menstrual cycle, morning nausea, heartburn. He knew all about her condition. I was a stupid little kid, but I finally figured out I was going to have a little brother. So to sum up the situation, Dr. Ducombe knew our family well. His longitudinal care for my family and me certainly left an indelible impression and was a model for me as I began my medical practice. Dr. Ducombe continued to practice in Clinton County area until 1976. He was active with the Illinois State Medical Society. He was a member of this House of Delegates. He was a delegate from Clinton County up until the year before he died. Many of you may know his cousin, Dr. Deanna Ducombe. She's a practicing dermatologist in Clinton County, and she continues her family's tradition in medicine. And she's here today. Please stand, Deanna. And anybody in that part of the hall knows Deanna because she's not quiet spoken. You know where she is on issues. I highlight my family's personal experience with Dr. Ducombe because I see the value of a knowledgeable primary care physician for good patient quality care. Dr. Ducombe was able to keep important facts about patients in his head. His office record was like little 4x6 index cards. He put a couple scribbles in and popped it back in the holder and back in the record. It was not what we'd call a 99213 or a 99214 by any means. He didn't have very many specialists in the area to choose from for referrals. He pretty much did it all. But medical practice today is a little bit more complicated. The span and scope of the scientific fund of knowledge are greatly expanded. We can't keep it all in our heads. It has to be placed in the record for easy recall, and frankly, for the convenience of our patients. In most cases, that accessibility requires electronic records, which, as we know, are very expensive and they're difficult to use. But as important as it is to have sound record keeping, it's even more important to have the primary care doctor around. Primary care physicians are the fail-safe to protect our patient's health. Take an elderly patient who has arthritis going to see the specialist. She may have renal dysfunction, but doesn't tell that to the orthopedic surgeon. We have to make sure that there's communication between the primary physician and the orthopedic, that patient doesn't get put on non-steroidal anti-inflammatories that might worsen the condition. Primary care doctor interacting with the surgeon can make sure that key information is passed along. If I have someone going for elective surgery who 12 years ago had postoperative DVT and pulmonary emboli back then is no longer on anticoagulation now, but the surgeon needs to know that. We have to make sure that there's good DVT prophylaxis in the postoperative period. And so my message to patients is that involving your primary care physician for managing care with specialists is important, both for safety purposes and for quality care. But if anyone thinks I'm overemphasizing the role of the primary care, I have to remind you of my bias. I'm an internist, that's what I do. But I appreciate all the specialists in this room and throughout the state, and I promise to represent all interests and views during my term in office. There's another reason why primary care is more important than ever. As I speak with Illinois physicians of all specialties, I hope to highlight the importance of upcoming changes in medical practice and in payment models and mechanisms. The President's Affordable Care Act speaks to changing the traditional payment service of fee-for-service, transitioning to one that revolves more around value-based medical care and payments based on meeting quality goals. Population management for chronic care conditions will also be important, not only with Medicare, but with commercial insurance plans. Already, there are programs being developed that give extra payments to primary care physicians to meet specified quality goals in chronic disease management, such as diabetes, coronary disease, and COPD. The Illinois State Medical Society can play an important role in supporting our members through this transition, but I don't think we should go it alone. I'd like to join efforts with other specialty societies to educate and prepare physicians on patient-centered medical homes. ISMS will explore a collaborative educational initiative on emerging care models that we're all working to try to understand. ISMS has made some initial outreach with leaders of several other Illinois physician organizations. I'm hopeful that the Illinois State Medical Society will help organize, in cooperation with the Illinois branch of the American College of Physicians, the Illinois Academy of Family Physicians, and the Illinois chapter of the American Academy of Pediatrics, to set up informational sessions for on organizing and preparing for certification for patient-centered medical homes, otherwise known as PCMH. This collaborative outreach will help delineate the steps necessary for a medical practice to get certification for PCMH, and this certification will be required in the near future to qualify practices for these quality-based payments from insurers and Medicare. Hopefully, these joint informational sessions, working with these other physician societies, will demonstrate value for members in each of the physician organizations and help improve ISMS's physician membership recruitment and retention. As is painfully evident, our decreasing membership is one of the greatest challenges we face as our society moves forward. We must show value to members in order to improve their stake in remaining with our society. We must also continue to showcase our other strengths, which are advocating for them in the state legislature, helping with practice management, and keeping physicians informed on the latest developments, regardless of their practice setting. I sincerely hope as we go forward this year that we're successful reaching out to provide educational resources for our physicians, thus improving member interest in our society, and most importantly, improving the quality of care for our patients. I thank Dr. Werner again for his efforts this past year as our president. He's been like the Energizer Bunny, traveling throughout the state, meeting with many different audiences, such as students, physicians, and legislatures on our behalf. I want to thank all my practice partners, and some of you are here today, for caring for my patients in my absence as I travel on ISMS business. I especially thank my most important practice partner, Dr. Ann Stewart, my wife, who's done the most work covering for me all these years when I've been up in Northern Illinois for the society. And once again, I thank all of you for your support as this year progresses. I look forward to meeting with your medical societies as I get a chance to travel throughout the state. I have the support of a wonderful administration team at ISMS headquarters, and I thank you all in advance for your support in this coming year. Thank you.